Hello everyone and welcome to Cowdrey's virtual wellbeing program. Firstly, I wanted to quickly begin by thanking everyone at Cowdrey who's been working really hard to organise and arrange these brilliant virtual wellbeing sessions, and I'm honoured to have been asked to record a short talking points video for you today. My name's Tom Nottingham and I'm an osteopath currently working at the Cowdrey Therapy Rooms. So before we begin, I'll give you a little bit about me. Before becoming an osteopath, I worked out in Greece in the water sports industry as a sailing coach and personal trainer. I was also really lucky to compete in various sailing events around the world, and it was during this time that I discovered my passion for osteopathy and in particular for injury rehabilitation. So I came back to the UK and enrolled onto an osteopathy master's degree at the British College of Osteopathic Medicine in London, and I graduated in 2016. Since then, I've worked in both private practice and in elite sport, where I've been fortunate to have worked for the Wasps ladies rugby team as the clinical lead therapist, and I worked with Hampstead and Westminster hockey team and with elite and development sprinters as part of Speedworks UK, which is based in London, where quite a few of the athletes have gone on to compete for Team GB, which has been brilliant. Some of you may have heard of osteopathy before, but others may not have. So osteopathy is basically a complementary therapy that is used as a way of diagnosing and treating a wide range of musculoskeletal dysfunctions and injuries. So as osteopaths, our primary principle is that we look at the body as a whole, and our treatments are based on the concept that the well-being of an individual depends on the joints, muscles, ligaments, and the nervous system all functioning smoothly together. So as osteopaths, we'll assess a patient by undertaking a thorough case history and clinical examination to better understand the likely cause of an individual's pain and their symptoms. Once an issue's been diagnosed, we utilise a variety of different therapeutic interventions, such as massage, exercise rehabilitation, sports taping, dry needling, whilst also providing some sound educational advice to help manage your injury or your condition. So that brings us neatly onto the main content of today's talking points video. I wanted to discuss some of the implications that working from home has had on our bodies, address some of the myths and misconceptions about posture, and follow it up with some short little things that we can do to help maintain a healthy body and lifestyle during these kind of times where we're stuck indoors more often. So in clinic, I've seen recently quite a few patients coming in complaining of neck, shoulder or back pain. Quite often this has been down more so to the significant changes that they've seen in their daily and their working lives. During the recent lockdowns, I've seen more individuals becoming increasingly sedentary, sitting down for longer periods of time, whether that's sitting down more for work or helping our kids with homeschooling, or even just sitting down more because we can't leave the house as often as we'd like. Even as I talk to you now, I'm sitting down at a makeshift desk recording this video, where normally I would be walking around, standing up, mingling amongst everyone and having a chat face to face. I'll hazard a guess and say probably a large proportion of us will be sitting down in some capacity whilst we watch this video. So our lives are increasingly involving more time spent sitting down. This coinciding with a reduction in the time that we get to spend keeping fit, whether that's through the closure of gyms, swimming pools or sports clubs, seems to have also slightly exacerbated the issue. It kind of now brings me on to a good period of time to talk about some myths and misconceptions that I've seen regarding posture. Firstly, and it's important to note that there's absolutely nothing wrong with sitting down. There's also nothing wrong with slouching, or these positions we've kind of historically seen as being quite bad on the body. Our bodies are strong enough to withstand these types of positions when asked. When we start to experience discomfort, it's usually based on how long we're in that position for. So the example I give to patients who I see is that if I was to pass you a pint of water or a pint of beer or a glass of wine, what is your preference, and I was asked you to hold that in front of you for 10 seconds, the vast majority of us could hold that without any discomfort or without any pain. However, if I asked you to hold that glass out for an hour, our arm would inevitably become tired, our shoulders will become uncomfortable, and we'll just find that it gets tougher and tougher to withstand that position. Once you've placed that glass down, you've shaken your arm out a bit, you've moved around for a short period of time, things start to feel a little better and we can return to holding that glass again. The same goes for when we're sitting down. So the muscles of our neck, our shoulders and our back are designed to keep us upright. So when we sit at a computer for hours and hours on end, those muscles can become fatigued and they can become tired, inevitably leading to discomfort and sometimes often pain. So by adapting the position and load that we're placing on those muscles, usually by getting up, moving around, or just simply changing a position that we're in, allows these muscles to have a quick break and they can then start to feel less uncomfortable. The body's primarily designed to move, so therefore movement is our friend when it comes to kind of our daily lives. These short little micro breaks are really important for our daily lives, to allow our bodies to move more often, especially if we're finding that we're sitting down for longer periods of time throughout the course of your day. And it doesn't just relieve the discomfort in the muscles, but it also can help us focus and stay energized for the time that we're spent indoors. So what kind of things can we do to increase the effectiveness of these micro breaks and reduce the levels of discomfort that can develop? It's important to note first off that there are loads of different exercises. These are just a couple of little examples that we can use, but also for each individual there may be different needs from how your body functions or how your kind of health circumstances. As osteopaths, we can adapt these exercises and techniques to each individual and make it much more bespoke for the issues you may be finding. So first of all, in terms of exercises, one of the first ones is making sure that we can get up and move around more often, whether that's just standing up and walking from room to room. Classic example I usually give is that if I'm on the phone, rather than sitting down and talking on the phone, I'll often stand up and wander around with the phone. So I'm moving whilst I'm walking. If you're doing a couple of laps up and down the stairs, or even just kind of pop into the kitchen every so often to make a cup of tea, it's easy to then break up the day of where you're sitting down in those positions for long periods of time. So if we're having to spend more time at a desk, whether that's through lots of Zoom meetings or homeschooling, there's also things that we can do whilst we're sitting down to try and take the pressure off the muscles that are getting fatigued and to get our bodies moving. Some really simple examples are if I was to cross my arms in front of me, relax my shoulders down, and very gently rotate just from side to side, just trying to get the upper back moving in a slightly different direction. A lot of the day-to-day activities we do nowadays, whether that's driving, reading, typing on a computer, everything's very linear, it's kind of very forwards, very backwards, and so by almost kind of introducing some rotations or even some side bendings into the equation, we can move our body in a slightly different way and relieve that kind of fatigue on those muscles that are having to try and hold us upright. Another one that I found really, really common recently and is generally quite common amongst kind of the desk working community is that being in that kind of position there, we tend to find the muscles at the front of our chest, our kind of pectoral muscles, start to become quite tight. So by just simply opening the chest up and allowing us to kind of get into those positions can be really helpful at taking the pressure off those muscles at the back. So a good stretch for that whilst we're sitting down is if I was to put my hand on my chest as if I was singing the national anthem, raise my hand and very gently bring my shoulder backwards or upwards whilst I'm pulling down with the opposite hand. You can feel that stretch just across the front of the chest there, and it can really help to relieve those kind of areas that are a little bit tighter. Other examples can be something as simple as some shoulder rolls, just trying to take the pressure off the shoulders if you're sitting down for a long period of time. There are many different examples of things that we can include into our daily pattern whilst we're kind of sitting at desks for long periods of time. And they don't have to be long stretching or movement sessions. Just a little bit done frequently is really helpful. And I always like to turn around to individuals and say, just become a bit more of a fidget, move around more if we're having to sit down in those positions. So to kind of quickly recap on all of that, we're spending more and more time spent sitting down or in some form of sedentary position. Slouching and sitting down is not bad for us at all. It's not bad for the body. It's more about the time that we spend in those positions that can lead to discomfort and sometimes to pain. So we need to try and reduce the length of time that we're in one position for. So basically, let's just get up and move around and allow your bodies to move and have a break from those kind of long seated positions. Simple exercises done little and often can act as really good micro breaks for the body, and they're almost as effective as kind of doing just a 20-minute session once a day. If we're doing lots of little exercises frequently, it can be really good at trying to relieve that discomfort, especially in our shoulders and into our neck. So that concludes this short talking points video. I hope that you found some of this information informative and helpful, and most importantly, I hope it gets us up and moving around a little bit more. If you're wanting to find out more, or if you have any other further questions about any of the stuff that I've talked about today, then my details can be found on my website, which is www.osteopathy.co.uk. You can also alternatively find my details on the profile page at Cowdrey Wellbeing website, and there's probably also some good bit of information underneath as well that you can follow up on. So thanks again to everyone at Cowdrey for arranging these fantastic events. I'm enjoying kind of seeing all the different kind of videos that are popping up and getting a good idea of various different things that we can do to try and keep ourselves healthy and well. So thanks again. Hope you all stay safe, and all the best to you all. Take care. Bye.